Welcome back, everybody. There's still a big need for those cloth face masks, and Intermountain Healthcare is collecting them for our community. So here to talk about what Intermountain is doing to fill the need is Dr. Shannon Phillips, Chief Patient Experience Officer at Intermountain Healthcare. Doctor, thanks so much for being here. Let's first talk about face masks. They're a big part of everyone's life now, but talk about why they're so important and how they really need to fit correctly to do what they're hopefully going to do.
Yeah, Emily, thanks for having me. The need is big, so as is probably escaped no one's attention here in Utah, our case counts are going up around the community. Cloth face coverings have the opportunity first to protect others from you, but they also give you some protection as well. And so if you combine a great face covering with good social distancing, keeping at least 6 feet apart, and great hand washing, you have every opportunity to keep yourself and your family well.
Which we love to hear. So let's talk about the best kind of cloth masks, and if someone is making them, what they really should be looking at to make sure that we are properly covering our face.
Right, so I brought one for you. So there actually are a lot of online patterns for these. You just want to be sure that it's going to cover, from your mid-nose to just under your chin, and then is wide enough to make sure you can loop ear to ear. And you can have fun with fabric. They usually have an extension in them, can fold, they can be washed, so they can be used over and over again. And so easy to do, critical to keep yourself and others safe.
Okay, let's talk about when we're wearing our face mask, because when I'm out and about, I see a lot of people will put it underneath their nose. And I get it, it can kind of feel like you're suffocating behind it, but by doing that, you're kind of defeating the whole purpose.
You're completely defeating the purpose, right? So when you're getting exposed, your nose and your mouth are where you're breathing in those droplets, right? And it's true, if you don't spend every day like a surgeon or somebody in healthcare with a covering on, it does feel different. If you make sure it's not too thick, not too many layers, again, because you can keep washing it and reuse, it maybe is more breathable for you, but if you have it, if it's not covering, you're not protected. So please, it's different, we need to get used to it. And we can do this.
We can do this. Now let's talk about how you guys are collecting face masks. If people are really good at making them, they can make some extras and help out people in our community.
Right, and for so many weeks, Utah stepped up making medical grade masks, right? And for the last number of weeks, we've been asking people to sew at home and make cloth face coverings. We're using these in our facilities, our clinics and our hospitals to share with patients and their visitors, and with our caregivers who are not patient-facing, who don't need to wear medical grade masks. We have sites all over Utah. There are 28 places that you can donate masks. We'll take those, we'll sanitize them, and then package them to be able to distribute at our doors. And honestly, we're giving them out across the community. We're sharing them with schools, with government offices. We shared them for the funeral of the fallen officer in Ogden several weeks ago, so that the police had thousands of masks for that. So we're sharing them wide in the community, and when we give them to people who come in the door, they can take them home and use them. So recycle, reuse, and keep yourself safe.
I love it. My family benefited from one. We had a random trip to the Instacare, and my husband didn't have a mask, and he was quickly taken care of. Dr. Phillips, thank you so much for being here. We so appreciate all that you and Intermountain Healthcare are doing for our community. If you want to find one of those locations to make a donation, we have a link for you on our website, abc4.com. Dr. Phillips, thank you very much.
Thank you.